And thank you for those of us who are tuning in and joining us now for our panel session. So what I'd like to ask Lewis Kaplan to do, our man in cyberspace, is to now bring back to the screen Jimmy Pollard, our original speaker from Boston in the USA. If you can turn on Jimmy. And I'd also like to welcome now Michelle Giles Clark, who's the General Manager of Huntington's South Australia Northern Territory. And if, ladies and gentlemen, if you put your, if you look on the right-hand top corner and put it onto gallery format, you've got two options there, speaker and gallery. I recommend that you put it on gallery because I want to have Kenny and Jimmy and Michelle, if you could turn on your video and your microphone. So can we practice deaf sign clapping? Clap each other because you've all done such a wonderful job. And feel free, if you would, to take yourselves off mute. If we get echo problems, I know you'll have enough initiative to quickly put yourselves on mute. What we're going to do now for about the next 20 minutes, just up till about 2 minutes to 2, is to answer some of the questions that have been coming in, and I've got some questions of my own. And just to let you know that immediately after the panel, we have a very interesting session in relation to specially designed beds and chairs for people living with Huntington's from Novacor. And I'll tell you how you can link into those presentations for very specialised equipment at the end of our panel session. Look, let me just come to you first, Kenny, if I may, because we had a question coming in there. I guess I have something for you in a minute, but I'll come to the audience question first, and that is the efficacy, the usefulness of the interventions there to prevent falls that you've outlined in such a scientific and comprehensive way. Any comments on how well it applies to people with later stages of Huntington's and also high levels of impulsivity?
Yeah, great question. It depends on, I suppose in terms of efficacy, there's not much work out there on the later stages, but what I can sort of draw on is the clinical experience that to help answer the question. And in terms of the impulsivity factor, that can be difficult because it acts as a barrier to participating in the exercises. And that's a big thing that we need to be able to do to perform the exercises for our gait and balance and fitness. It becomes more, your focus does shift a little bit more to the behavioral aspects of care. So we're looking more about safety, about looking at the environment that we can shape, and about educating the carers and staff who are looking after people with increased impulsivity to ensure that, and often we need to think a bit deeper about why the impulsivity is occurring. Often it can be a need that may not have been met. They could be hungry, they could be wanting a specific thing. And so to probably put the falls management side of things into as part of the actual care plan overall can help quite a lot. So therefore we're sort of mitigating the amount of time someone's getting up to do something. If they're a bit agitated, if we can work on why they're agitated, that can be a critical thing there. Often acceptability of walking aids is also a big thing as well, especially if it's introduced by someone they're comfortable and familiar with, can help with that. So the focus moves from performing exercises as such to more external factors, behavioral factors, looking at the care plan in terms of the impulsivity. Later stage, obviously very difficult to, if you can't perform the exercises, or we're moving towards more, my occupational therapy colleagues would be, have a larger role to play in that part as well.
Look, thank you very much, Kenny. And I'd like to come to you, Michelle, now, if I may. You've just watched that all, I'm sure, very intensely. What were 2 or 3 factors, insights, observations, recommendations raised by our speakers that struck you as very useful and worth re-emphasising? Is there something that really attracted you?
I'd like to thank all of our speakers. They were amazing. And it's really nice to meet you, even if it is on Zoom. I guess there's no one particular thing that stood out to me, except that in all my 17 plus years of nursing people with Huntington's, the one thing that they have all expressed to me is they are a person first and the Huntington's disease comes second. And that is just so important. And that's the way I do my education, I do my training for all of those support workers, the families, or anyone who wants to listen to it.
Thank you, Michelle. I mean, it goes very much to that thing of the importance of not generalising and seeing people very much as individuals in whatever role we're supporting people. Jimmy, you've had a lot of praise, as you've probably seen in the Q&A and chat functions. So people value very much your insights. If I could just ask you a couple of questions. You mentioned that you'd been to 16 countries and you'd visited all manner of professional home service. I hate to call places facilities because who on earth wants to live in a facility, but you know, places, professional home environments. And I wondered if is there any observation you could make about what makes it more likely that the organisation is going to be doing well? You know, is it about leadership? Is it, you know, if you could try paint a picture of one or two places you've seen, you think, wacko, if I had Huntington's, that's where I'd like to live. And what were they doing right and what made it possible?
Well, first of all, Tank Care is one of them. I've been there. Charlotte's home. You know, first of all, you know, I'm an American and our nursing homes are just very regimented and they still exist. The nursing home culture in the US is still biased towards geriatric residents. So if you're a young person in an American nursing home, if you're a person with HD, your relative youth is probably going to be your biggest liability, not your HD. But you know, in your question, you touched on all the key points. Leadership is huge. It's just as important. And unfortunately, you got to be around a long time, like 30 plus years, for me to come to the realization that the people at the top of the hierarchy are just as important as the direct caregivers. I know the direct caregivers give like 95% of the care, but as you go up the food chain or the hierarchy, if you don't have the support at the top, the program is not going to last that long, and it won't be terminated suddenly. It'll deteriorate over the years, and the ones who will pay the price of that are the residents and the direct care staff. In other countries, including Australia, again, because I'm an American, you folks, and this is true in Scandinavia, of which Charlotte is an example, you actually practice, I don't know if practice is the word, but recognize autonomy of residents. Or as Michelle said, people first and choice. Americans talk that, but we really play lip service to it. We really don't do that a lot. So, you know, my answer would probably be, I can't think of an American home that I would choose, having seen other homes around the world. And everybody's doing a good job. And I don't say that just to be nice and charitable. Everybody does a good job within the context of the national health system. And they're so different, man. You know, it's really hard to say.
I guess, Jimmy, what just like to say, just so you know, here in Australia, we've recently had the findings from a Royal Commission, which is a system of public investigation that we inherited from the British, but a very comprehensive investigation into our aged care system, which of course I'm assuming is where a lot of people with Huntington's may find a residential service. And while there was some excellent work, there was a very disturbing quantity of very poor work and even punitive and well, I mean, negligent, and Michelle, I mean, I'll use the language of an ordinary person, at times people that should be criminal work. And there will, I'm sure, be legal action taken in relation, if at least civil action in relation to some of the findings. So I'm just letting you know that and why do I mention it now? I'm a great believer in giving people hope, and we know a lot of families are watching, and some may have family members with Huntington's who are still with them at home or being supported at home. And if you're in a situation of needing to look at what residential services may be available when it reaches a time when you feel you can no longer support your family member, is there any tips? And I'll come to Michelle and Kenny too for a quick comment in a moment, but one or two things, a practical advice on what to look out for when you're trying to find a place where, you know, someone that you love and care about will be safe and hopefully flourish. Because we look at it, the Danish example, and we think, golly, if it only could be like that.
Two tips.
Jimmy, but what would you say?
Two tips. First one that comes to mind is trust your instincts. Visit a place and don't listen to, like here in the United States, our state departments put out guides for evaluating nursing homes for families. And it'll be a list of questions like, what's the staff resident ratio and all of those kind of things. How many complaints have you had and all that stuff. None of that really matters more than just people's intuitive gut reaction when they visit it. Trust your instincts. And I can't say that enough. I mean, you know, there are some obvious ones. If there are odors and, you know, whatever, and the stuff that's in the guides. But I really think, you know, your loved one, and you know, you can project how he'll get along there or what you think of it. So one is just trust yourself. And the other one is, and again, I speak as an American. Our nursing homes have such a bad reputation as institutions. And I'm not a shill for the nursing home industry, but they're not the god-awful places that people are led to believe by media and hearsay. People live very fulfilling lives, even in the most advanced stages of Huntington's disease, all over the place. Yes, Huntington's disease families hear the horror stories and that they're there. But most residents with HD do pretty well in nursing homes. So I point that out so that you don't go in with a overly critical adversarial eye. Which brings us back to number one, trust your instincts. I don't know if there's anything more than that I could say.
Yeah, thank you so much. Michelle, would you like to comment on that issue of for families who want to do the best they can, what should they look out for? How can they do their best?
I think the best thing that they can do is, if they know of other Huntington's families who have been put in that situation, to have a chat with them. Often that can be extremely helpful. The other thing is, every state has an association who are well aware of what would be considered to be good situations for those with HD to be placed into, and ring them, have a chat with them. I agree with everything Jimmy said. There are good, there are bad. We have the same thing here in Australia.
Thank you. And Kenny, would you like to comment on that before I ask you a different question?
Oh, look, it's an incredibly important decision for families, and look, the best I can say is for people to listen to some good advice before making such a big decision. In terms of the physiotherapy side of things, I think if possible, are you able to meet with the physio? Can you gauge how much experience they've had with neurological conditions? How much they do for falls prevention? How often they will review your loved one if you raise any concerns? So I'd say that's probably some key things to think about, to have a chat to the physio about.
Yes, and I guess questions about the availability and access of allied health staff, as you know, whether it be in-house or external. Look, Kenny, I just think I know you had some take-home points at the end, but I wonder if you could give us a couple of bits of practical advice for any professionals who are watching today on one or two things if they want to improve the nature of the falls prevention work in the place that they're working. Are there one or two practical things they can do, either in relation to reviewing the environment, which you emphasised, or on gaining access to professional physios if one isn't available in the place where they're working? Any just nugget tips, calls to action?
Yeah, look, there are a lot of good things happening already in the falls prevention space, and a lot of different facilities, current systems and policies and procedures. I think if you're a clinician working directly with patients, I think the first thing to do is to speak to those within your facility that are already doing some great work. I know there are a lot of people doing some fantastic things. Get to know what's already happening. You may be surprised there are more things happening than you realize in the background. And participate, I would say. Yeah, go on.
At home, if there's family watching and they're still supporting a family member, or they're supporting a family member at home, not everybody has the money, do they, to get access to private physiotherapy. I say that as a daughter who helped my elderly mother for many years and was able to afford private physios, but they're not cheap to come to the home. What can families do in terms of, one, accessing publicly funded physiotherapy intervention, or two, engaging in getting guidance on exercise as they can help with their family member at home?
Yeah, so depending on the age of the person, then you can either access some physio through your home care package through the My Aged Care system. Otherwise, there's also the NDIS system that can give you funding for physiotherapy. They're probably your two broad systems there when you're out in the community. In terms of publicly funded physiotherapy, it can be different depending on the different health district you are in. So your first probably port of call is to go to your GP to find out what can be accessed, because often the referral pathway is through the GP.
Thank you very much. So GPs, general practitioners, are so crucial, aren't they? And we're lucky enough to have Medicare, Jimmy, here, where many people can access them bulk billed, so you don't actually pay a fee. But Michelle, would Huntington's associations be another source of advice? Because understanding the National Disability Insurance Scheme or My Aged Care schemes, that it's not easy. I've been involved with both in my time. And do Huntington's associations assist, or social worker at a major hospital? Where could people get help?
Most states have allied health people who can help with NDIS, aged care advice. I know we in South Australia, they can give me a call. I have no issues with that. If I can't answer the questions, I can pass them on to a couple of our amazing social workers who know the answers, and I'm pretty sure it is the same in every other state. We're lucky to have NDIS. I know it's been a bit of a trial, as has aged care for a lot of people. But if you can work through the system, it is extremely helpful for those people that need things like physiotherapy and any other services that they require.
Thank you. We've only got time probably for one more question. And golly, there were so many things, Jimmy. I want to come to you, if I may, that were raised by our Danish speaker, Charlotte, I think, if I'm meant to say, Charlotte Hold. I just want to list the notes I took. And if you could choose what you think are one or two things we should lobby for here in Australia to make them more widely available: free homes, free external supervisors, 24/7 food preparation, a focus on minimizing frustration, and that include 24/7 food, never saying no, always having an alternative possibility. And I thought very interesting comments around the role of volunteers and the establishment of a volunteer association, the Friends of Tankere, and that being a mechanism for being able to independently raise funds. When we watched those marvelous videos of Tankere, we saw how many people were involved in that musical session and dancing. And I thought, gee, I wonder how many of them are volunteers and how many of them are staff. So what would you want to highlight as something we all need to lobby for in our worlds, wherever we are?
I just take your lead. And I mean, as an American, I'll take that whole list of that you just cited, that she referenced. I mean, some of the strategies, like never say no, that's not a biggie. People, you do that and that's cross things. But all the other things you said, yeah, I want those too. And I really want to say, though, about having watched that video, that is, having been to Tankere for pretty much 5 or 6 hours one day, that's representative. And about the volunteers, I remember wondering, as I would approach people, is this a volunteer? Is this a staff person? I mean, they're that all over the place. It's very, very impressive to see.
Look,
But you know, to hear you guys say you want, that's our wish list too.
Could I just say, before I bid our panel farewell and introduce you to our final segment, a big thank you to Lewis Kaplan from New South Wales ACT Huntington's for getting together that presentation from Charlotta. And I know he got access to those videos and actually showed the service, and then has put some effort into editing them together in that way that we could see. And remembering that next week, these presentations will all be available on the website. As someone who's been involved as a cancer survivor and needing certain kinds of help, and also a carer for my elderly mum, there's nothing like seeing what other people are doing to gain inspiration and hope for what is possible. And I think that's true whether we're family members, people directly affected by the health dilemma, or, you know, highly motivated health professionals like Kenny, who can say, oh, gee, you know, it'd be great to get that happening where we are.
Yeah, when I saw that equipment gathered there, it was just like a cash register was going off in my head.
We've got to stay optimistic, Jimmy. We've got to get that money. We get that Friends organisation. In Australia, we have sausage sizzles. You probably call them, what do they call them, Kenny? Hot dogs in the United States. You've got to stay optimistic. I say that as someone who's had stage 4 cancer. It's my life decision. Ladies and gentlemen, can we all clap each other, hand clap, Michelle, Jimmy, and just so grateful to you, sir, for staying up so late in Boston. Kenny, just wonderful to see the high professionalism of your work. Lewis Kaplan there doing great work behind the scenes.